are you?
Good.
This
How's your
meeting
day
is
going
being
today?
recorded.
Great.
Rudely interrupted there by the recorder.
Oh yeah, you're good.
Um, so yeah, I really appreciate you taking the time to speak with me today. We'll be going over some questions. Not sure if you had a chance to look at the email that I sent you earlier with a few of those notes in it. Awesome. That's great.
Yes, yes, I
Perfect.
did.
Just going to change the view here and we're going to be able to get started. Great. So if you could just start off by letting me know your name, where you live, and your specialty.
Sure. So my name is Victoria Page, and I am an ENT, specifically a laryngologist. I just moved from Florida to Baton Rouge, Louisiana.
Great. And thinking back to coaching and before you'd started, what was your life looking like at that point before you had began on your coaching journey with us?
I found that my charting and ordering things and just spending time at the office, not directly seeing patients, was extended, and I was often leaving the office 6:30 or 7. I'm not one of those types of people that likes to bring work home at all, and I know I won't finish it if I bring it home. And so I was just kind of staying at the office. Even if I was done seeing patients at 4, I was often there until 6:30 or 7.
And as a result of that, what do you remember about your emotional state at that time? How are you feeling about that?
I was pretty frustrated and kind of jealous of like other doctors who were able to just write really short notes or maybe be short with the patients. I'm not sure what they were doing to kind of get rid of a lot of that extra time, outside of the patient rooms. But um, I was pretty frustrated, and honestly, I went through this program because I was thinking about switching jobs, and that just happened. So to me, I'm halfway through the program, and I still have to do the other half, which is kind of use all these things that I learned in the
Right.
new job, which I just started last week, and I
Oh,
haven't even seen a
congratulations.
patient yet. Yes. So, yeah, I'm in orientation right now. But yeah, I was pretty frustrated with the just time I was spending at work outside of patient care, and um how much time it was taking me to close my charts. And I'm the type of person, I'm going to close it the same day, almost 100% of the time. So I was staying at work very, very late.
And as a result of staying at work so late and not being able to set those boundaries between your personal and professional life, did you find that there were things that you wanted to do that you felt unable to do?
Yeah, absolutely. I mean, I want to go home and spend time with my family. I want to have time to work out. I want to have time to even answer my outside emails. Do yoga, things like that, and certainly couldn't do that stuff during the week.
Yeah, and you mentioned that spending time with your family was really important to you. When you were in this position, when you were feeling overworked and having to stay at the office late, did it have an impact on the people that are around you as well?
Yeah, absolutely. I mean, I can't be there to get dinner ready. I'm showing up, at 7:30, like exhausted, haven't picked anything up. It's definitely hard when you're working really 12-hour days when they should be 8, you know.
Yeah, yeah, absolutely. And when you decided to make that jump into coaching and taking that first step, had you heard about coaching before and decided to come to us, or was your experience with us your first experience with coaching?
My experience with you is my first experience with coaching. I hadn't really heard of it within medicine.
Hmm.
Um, uh, and I saw a commercial for it online. I can't remember if it was Instagram or Facebook. Um, and it was one of the very few times that I did bring work home with me. And it was like 11 p.m. on a Tuesday, and I was sitting there in my pajamas writing notes, and it's like, are you a female physician sitting in your pajamas writing notes at 11 p.m. on a Tuesday? And I'm like, yeah, pretty spot on.
Right.
Um, so, I'm glad that that I saw that and I was able to connect with you guys.
And after you saw that and kind of maybe into the first discussion that you had or the first touch point that you had with the program, did you have any doubts or fears about getting started with coaching?
Not really. I feel like I had very linear goals, like things I
Hmm.
wanted to hit, very black and white things. Um, I've talked to other people who've now that I know this is the thing that have, considered it or even done it. And they've found that it was, if they didn't do well, it seemed to be because they didn't have goals. And
Right.
I felt like I had goals. I figured out how to hit them with the program and I hit them. I hit them before I left my old job. Now I'm going to try to see if I can use that same stuff to hit them again here without falling into very long clinics. I negotiated a 4-day work week over here, which is great. It just means that
Amazing.
what was an 8-hour patient facing day at my old job will now be a 10-hour patient facing day. And because I was having like 4 extra hours of paperwork to do in the course of that day, um, I was worried it was going to turn into like a 14-hour day here. And so that's what I'm
Right.
trying to avoid. Hmm.
Yeah, definitely. And with those pretty direct and concrete goals that you had in mind when you were starting, do you remember how you felt in that first session when you got started? And were you kind of able to hit the ground running and start working on those goals right away?
Yeah, definitely. I was really excited to try to kind of implement some of these things. And a, a, a lot of them or a lot of people would be like, "Are you ready to do this? Are you ready to make changes?" I was like, "Absolutely! Like whatever you can do, I'm trying it tomorrow morning." So I feel like I hit them really quickly, and a lot of things were pointed out, um just things I can change that I think made a very very big difference for me in my practice and allowed me to get to where I want to be. And I didn't realize how I was limiting myself in a lot of ways. And as soon as I was able to like see that, uh, you know um I was able to change it pretty quickly.
Yeah. And tell me a little bit about where you are now.
Yeah, so I just started. I haven't actually worked in about 2 months. So I'm in orientation here. I'm working for a hospital group with a couple other ENTs. I'm going to be their only laryngologist or subspecialist within throat. And I'm very excited to start. My first clinic is tomorrow. And I already kind of know how I'm going to approach things, and how I'm going to try to not fall behind. Of course, they start you out really, really slow. It's like a patient an hour for a
Yeah.
couple of weeks. But I eventually would like, I want to kind of ramp up relatively quickly. And, within 3 to 6 months, I want to be where I was before in terms of the patient load and the
Yeah.
volume I'm able you know, to see.
Hmm. And thinking back on how you were feeling about your work and sort of internally before you started coaching, if you could compare how you might have approached your new position now to how or sorry, then and how you're feeling then with how you're approaching it now, what do you think about would be that's the big differences there?
I think I'm looking at it a lot more positively. I think I was very worried that I was going to come here and work like 14 hours straight, and that's now that I've had this coaching, I just don't think that's going to happen. Like I do anticipate being able to walk out when clinic is over and not have to sit there for hours on end afterwards, kind of finishing up. And I do think those things that were tripping me up before, I'm going to recognize them right off the bat now, so I can navigate around them.
And in terms of finding your new position that you're in now, was coaching helpful with that as well?
So I had already found this
I
job.
see. Yep.
Yeah. My husband been looking at this area for his job for about a year. And so I found it, man, I was almost I had my first phone interview like last October. So before I met you
Okay.
guys.
Yep.
But and then we physically interviewed in person in February. Um And then I was like, okay, like I have to change things because I really want this 4-day work week, and I do not. I'm not gonna work 14 hours straight, you know.
Yeah. Yeah. And last question, what would you tell somebody who's watching this video right now and is unsure about taking that first step with coaching?
I would, I would say if you have like clear goals, and uh, you want, this can definitely help you get there. If you're looking to cut down on the amount of charting and time spent ordering, or even, time spent in the room with the patients. I think this is a really good way to do that. I used to get stuck in rooms a lot. I feel like I'm much better at kind of controlling the flow of my clinic visit, and that helps a lot with time management. I think that this can be a very helpful and valuable tool to help you get there.
Amazing. Anything else you wanted to add either about the program or your coach individually?
I think C is great. He's really wonderful. I felt kind of bad for him because I hit the goals and then I hadn't started my job yet. So we just kind of talk about other things and I don't have other clear goals. I just had like, I want to hit this and this. He helped me get there like pretty early on, like second visit, you know. Um, and then now we're setting it up so I'm going to see him again, like after I've started
Right.
here and actually are implementing them here,
Yeah. And things have started to
and
ramp up maybe a little. Yeah.
yeah, exactly. And I can see if there's anything else holding me down here. It's going to be relatively similar, but it's still like a new environment with people I've never worked with, and
Yeah. Of
um,
course.
mhm. So I'm excited to continue to work with him to try to make sure that I kind of stay on track.
Fantastic. Well, congratulations on starting the new position. I hope your first clinic day tomorrow is, and everything that you've been working towards. Sounds like you've made a lot of really positive changes over the course of coaching with Sia, and excited that you're going to be continuing that. We'll make sure that I contact him and get you your free session for doing this for us. And yeah, really appreciate your time.
Great. Thanks so much, Patrick.
Thank you, Victoria. Have a great day. Bye bye.
You too. Bye.